Welcome to Perimenopause Hell. This video is about the vulval skin disease Lichen Sclerosis. And this topic is very close to my heart because I suffer from it myself. And it's a skin disease that can start at times of low estrogen. And so it often starts during perimenopause and menopause, and actually also during breastfeeding, which was when mine started, because that's also a state when your estrogen levels are low. Now, I will usually suggest this video to women who are having some very severe discomfort, which is probably atrophy. But if you treat your atrophy and still you are having some of these symptoms, then you should go and see a doctor with the possibility of investigating it for lichen sclerosis. Lichen sclerosis can be spelled like this, or it can be spelled IS at the end. That both ways are actually correct. So the symptoms of lichen sclerosis are itching and burning. Particularly, you'll notice that the burning pain can be felt when you urinate. So if you urinate on your own skin, then it really stings afterwards. You might have white patches of skin on your vulva, or you might have a rather purple or red colour on your vulva instead. The white patches may be repeatedly mistaken for a yeast or thrush infection. In fact, many women who have lichen sclerosis have been treated many times for yeast or thrush, as we call it in the UK. But of course, it doesn't resolve things. You may also have this illness around your anus, so you might have a rather itchy bum too. And in the later stages of the disease, because the word sclerosis means scarring, you might have your labia minora fuse or seem to disappear. They haven't actually gone anywhere, but they fuse to the outer ones. And the clitoris can become buried underneath the scarring skin, which is very distressing, of course. The opening to the vagina can close up. That area can often be referred to as the introitus, so the opening to the vagina can almost close up, actually. And that's to do with the scarring part of this skin disease too. So you'll be thinking a lot of these symptoms sound a lot like atrophy, and that's true. But lichen sclerosis can be complicated by atrophy, and atrophy can be complicated by lichen sclerosis. So these two diseases can go hand in hand. Many women are going to be confused about which doctor they should ask to see for lichen sclerosis, and in fact, sometimes their GPs won't know anything about lichen sclerosis. And if you join a Facebook group for sufferers of lichen sclerosis, you're likely to see that women have had numerous roads to diagnosis. As I think I've already mentioned, it took me 10 years to get diagnosed because there were just so many doctors that didn't know what it was, or they thought that it was something else. I also suffer from psoriasis, so it's very easy for it to be misdiagnosed as another skin disease. Some doctors would send you to see a dermatologist, and then the dermatologist will be rather confused at you, trying to take your underwear off and show them your genitals because they don't treat that sort of skin disease. And gynecologists do not treat skin diseases, they treat gynecological conditions. So it can get very confusing which one to go and see. Gynecologists, too, are not the best at diagnosing skin diseases, and in fact, I'd continued to see gynecologists for a number of years whilst having symptoms that were very obviously lichen sclerosis when you know about LS and what it is, but not one of them actually ever mentioned it. So there's a lot of doctors that don't know anything about it, which is really rather sad. And although it's supposed to be a rare skin disease, I think probably it just is a massively undiagnosed skin disease, and there are lots of women out there suffering with it. The right place to go for help is without doubt a vulva clinic. Now, these are usually run out of dermatology departments, but a dermatologist oftentimes will not wish to look at your genitals. They don't regard that as being part of their job. Vulva clinics often run once or twice a month out of either a dermatology or a gynecology department. So your GP or PCP needs to refer you to a vulva clinic. My vulva clinic is 90 minutes out of the town that I live if the traffic is good. It's a long way for me to go, but the doctor there is incredibly knowledgeable, kind, and treats me well. And best of all, she knows what my skin condition is. The standard treatment for lichen sclerosis is a very strong steroid cream called clobetasol. In the UK, we call this Dermovate. Sometimes your pharmacist will look askance at you when you bring in your prescription for this because it really is very strong. And the idea to many of those people of using it upon your genitals seems like madness, but it is the only treatment, and it is your best bet at stopping the scarring, and it is also your best bet at preventing cancer, because lichen sclerosis increases your chance of developing vulvar cancer by an estimated 5%. The biggest study of treatments of LS was in Australia on 507 women, and with the women that complied with the regimen where they used clobetasol at least twice a week when they weren't in a flare, which is what is called a maintenance dose, none of those women developed vulvar cancer. So it is considered your best chance of preventing vulvar cancer is to use clobetasol twice a week. Now, there are alternatives. Some women find that clobetasol is rather irritating. Now, there are ways of getting round the side effects of it that I'll tell you about later that are just non-medical and home treatment ways of reducing your irritation. And you can use a lower dose steroid if you really can't tolerate it. The other option is something called tacrolimus, and this is a cream that is used to reduce the activity of your immune system. But the previous treatment that I showed you, the clobetasol, is the better one, and that's the one that most women use. Now, as I've said, it can be difficult to get a diagnosis. At the present time, you are probably extremely uncomfortable, and whether you have atrophy or lichen sclerosis or some other kind of genital skin condition, some of the tips that I tell you now are going to be very, very useful to you. With your urine burning your skin whenever you urinate, it can be good to run water over your genitals while you're weeing. So you can get a squirt bottle, or you can use one of these. They're sometimes advertised on Amazon as Peri bottles, Peri, and you can get portable bidet type things as well. Or you can just use a very ordinary squirt bottle as you would use for a sauce like mayonnaise or whatnot. You could even just wash out one very well that you'd used for a sauce. So you don't have to spend any money. Make sure you're squirting yourself while you're weeing and afterwards with plenty of water. And that makes sure that your own urine doesn't actually sting your skin. This can be very, very useful if you're having a flare-up too. The other thing I will say is to avoid toilet paper that contains lotions, fragrances, or balms. So you would think that a toilet paper like that would be good for you, but just go for a plain white one. So if you see the words on the packaging that say it's enriched with aloe vera or shea butter or anything like that, just abandon it, because those particular toilet rolls often have added ingredients like formaldehyde and things like that to prevent them going moldy. And those are very, very bad for sensitive skin. In the UK, we call baking powder bicarbonate of soda. And this is also a very good tip for cystitis, i.e. urinary tract infection. If you put 1 teaspoonful of baking soda in a large glass of water, about a pint, and mix it all up, when you drink that, it will reduce the acidity of your urine. So while you are having such difficulty with stinging when you pee, this will actually reduce the acidity of your urine and stop it stinging so badly. It's really, really useful for urinary tract infections too, and will stop you having that feeling that you need to pee all of the time. Of course, with a urinary tract infection, it won't get rid of the bacteria though, so you still need to go and get some antibiotics. But it's good in the interim. If you have very sensitive skin around your vulva or you have lichen sclerosis, you're going to need to consider changing how you wash down there. So using soap is not a good idea. Using any of these feminine washes that you can buy is also not a good idea because generally they're full of chemicals. My dermatologist prescribes me with this stuff called balneum cream, and I use that. I don't like using it as much as soap, and it's a bit of an adjustment to make. It's almost like with the habit of a lifetime of using soap that you don't feel properly clean afterwards, but really it's much better to change your ways because soap is just not very good for genital skin. Of course, the ideal thing to do is just to rinse with water down there, and that is what any gynecologist or dermatologist will tell you is the absolute best for your skin. Very difficult to do if you've been brought up to wash down there, of course. This beautiful looking item here is known as a Sitz Bath. This is one that fits over a toilet. Soaking, as in sitting there with your lower half in some warm water, can be very, very useful for alleviating lichen sclerosis symptoms like itching and burning. It can be very, very helpful. It's often suggested too that you soak for 10-20 minutes before applying your steroid cream, and that can help with the toughening and scarring of the skin too. Now, I don't find this kind of Sitz Bath very helpful. It's not deep enough for me. So you can get a big bowl and use that instead. Of course, that does present its own problems with where do you keep the bowl and emptying it and all of the rest of it. But this I find is the better option for being able to get the water right up to the level of your clitoris, for example. Now, there is amazing controversy in lichen sclerosis sufferer groups about this stuff, which is called Borax. Actually, in Europe, you can only get it from special retailers. They're usually retailers that deal in the sale of chemicals. It used to be a very common household detergent, just like it is still in America these days. Um, but we can only get it from certain locations. If you want some, contact me on the group and I'll tell you some of the suppliers in the UK where you can get it. Usually it's something you would buy online. Now, what you would do is use a small amount in your Sitz Bath, and I don't know why it works, okay, but it does. There's no doubt about this. But in the Facebook groups, you get arguments breaking out between women about, some women say you mustn't use the clobetasol, it's bad for you, it's big pharma and all the rest of it, and you should use borax instead, even to the extent of drinking it, which I think is lunacy. It works if you soak in it. I don't think it's a good idea to take it in water because it can harm your kidneys. Nobody ever seems to want to discuss that in the natural alternative groups. In fact, in some groups, the subject of borax is completely banned and you will be blocked from the group if you even try to discuss it. But I will discuss it with you. It works when you soak in it. What you would do is start off with perhaps a quarter of a cup and then half a cup until it's as strong as you can tolerate, which is never really more than a cup, I would say. And for some unknown reason, It does get rid of the itching. It will help to heal any tears that you have, because these little cuts, like paper cut type tears of the skin down below, are very common. Once again, I'm going to say I don't know why it works, but it does. Don't discuss it with your dermatologist, for God's sake, because they'll probably think you're stark raving mad. Some of them, I'm sure, will have heard about it, and some of them might even say, well, it doesn't harm anybody, I don't think. But you don't have to make a decision whether you are going to use borax or steroid creams. You can use them both if you want to, and it's nobody's business but your own. You don't have to discuss this with anybody else. Do what works for you. All I can say about the soaking regime is you should do it daily or every other day. If I had a flare up, I would do it, and I know that it would help. But in a day-to-day situation, it's really hard to find time. I live in the UK. Our houses are very much smaller than American people, so there's the case of the tub that I use is outside in a shed somewhere, and it's fetching it in. It's just difficult. It's not the easiest thing to slip into your routine. If you have a bath daily, using it in the tub is fine. Of course, you have to make sure it's only you that's in the tub on your own, as other persons might find it irritating to their skin or whatever. Alternative to borax, actually, you can use baking soda or bicarbonate of soda in the water instead of borax as well. That's another alternative. Once you are all washed and dried and you've applied your steroid cream, if you're down to a weekly dose, or you don't even have any steroid cream because you're not diagnosed yet, then you can use coconut oil. Quite often that brings some measure of relief. You can use it externally when you have sex, so it prevents any tearing, because the skin does get more delicate down there when you have LS. So that's a very useful thing. For itching, if you're having a bit of a flare up, something that contains lidocaine. In the UK, we have this product called Vagisil, which is really good. In America, there's something called Dr. Numb, which is even stronger than this. I think it's about 5% lidocaine, and it's got a small amount of local anesthetic. That's what lidocaine is. And so it really dulls the nerve endings. There are lots of medicines you could also take, like amitriptyline, which they call Elavil in the States. That's something that can also reduce itching, or you could even try Benadryl at night, because it makes you drowsy, so you wouldn't particularly want to take it in the daytime. But the itching from it can be alleviated. Of course, we have the vexed issue of talking about underwear. A lot of dermatologists would just say to you, if you can face going commando and not wearing any underwear at all, that's by far the best thing that you can do. You mustn't wear anything that is like a swimming costume material or polyester. Unnatural fibers are very bad for making the genital skin sweaty, and they are not breathable, so they're very bad for lichen sclerosis, of course. Some women can't bear the idea of being without underwear, and of course they might try a material like real silk, not the polyester satins that you get. I'm talking about very expensive real silk. I would just say that 100% cotton or bamboo cotton, which is a nice product that we have these days, are the best way to go. Make sure they are not overly tight, and make sure you use non-biological washing powder. Everything must be as natural and non-irritating to skin as possible. In fact, some women just abandon underwear altogether, and they might wear something like this instead, which is kind of a modern take on bloomers. These are called harem pants or Alibaba pants, or a variety of things that you can wear under a long dress. Sometimes this really does necessitate changing your entire wardrobe if you can't wear things like jeans anymore, which are, very painful if you've got this kind of condition and it's not well controlled yet. What I will say is that this is a very unpleasant skin disease when it is poorly controlled. When it's flaring up, it can be absolutely miserable. But I'm 2 years on from being properly diagnosed now, and I would say that it's 100% better. So please, if you are suffering from something like this, you must get it diagnosed because of that increased risk of developing cancer of the vulva. So you need to see a doctor at least once a year who knows what they're looking for and be on their books so that if you have anything that concerns you, any little spots or patches that appear that worry you that they may be the start of cancer, so you can get in and see them straight away. It's really important to be registered with that correct type of dermatologist that can treat you for this. But please don't worry. Don't look at all those photos on Google, because photos of vulval lichen sclerosis can be very alarming. Mine has never looked like any of those very scary photos, and actually it's in very good condition now. So that's the end of this presentation. If you found it useful and informative, I do hope you will like and subscribe and all those other jolly YouTube thingamies. Thank you for watching.